Michael, we're tracking all of this. We talk about what we don't know yet and trying to give people the actual information we do have. When you look at the history, COVID hit during the Trump era, and there are things we're only learning now about what happened then, including some just shockingly irresponsible behavior by then-President Trump. So the fact that it's in the past doesn't mean it's not news. This courtesy of a book by his own chief of staff, Mark Meadows, who was in the news under pressure like Bannon for cooperating with the insurrection probe. He writes that though he knew each candidate was required to test negative for the virus within 72 hours of the start time of the major Biden debate there, nothing was going to stop Trump from going out there, even though he tested positive. That, among other things, led Jen Psaki to hold forth today at the White House. Take a listen.
Well, I think the fundamental question here is, what are you doing to save lives and protect people? And the former president was suggesting people inject bleach. He apparently, reportedly, didn't even share with people he was going to interact with that he had tested positive for COVID himself. He continued to provide a forum for misinformation, which probably led to people not taking steps forward to protect themselves, to wear a mask, to eventually get vaccinated.
Michael?
Well, I've been saying for over a year now, and going on 2 years, that leadership sets the behavior, good or bad, in the general population. So no one should be surprised, A, in how Trump approached this, because we had that evidence very early on, going back to February of 2020. B, no one should be surprised by the fact that people have responded in some measures and quarters around the country the way they have to the advice, the warning, the information that individuals like the good doctor has shared with us over the past 2 years, and other physicians and health professionals. How that gets discounted and disrupted because of an arrogance of selfishness that these individuals have. So this Trump revelation doesn't surprise me. I don't know why we are acting as if we are surprised by it. We've seen a consistency in the pattern, and to what we were just talking about and what you've reported on before, the question in dealing with not just Delta, but every variant that comes in the future, because this thing has gone from pandemic to endemic, as the doctor has said. It is going to be among us. So it still relies on us and our behavior now to deal with it. And so you're absolutely right. If this had occurred a year ago, the death and hospitalizations would have been horrific levels. But we have seen the benefit of vaccinations. We have seen the benefit of wearing the mask, and in some cases, draconian efforts to enforce that, much to the chagrin of a lot of people. But keep in mind, those measures were put in place because you wouldn't do the right thing. So, we have to understand our role and responsibility in how we get on the other side of this. The doctor can come on here and tell us day in and day out, folks, take an aspirin, folks, check your temperature, folks, to deal with every kind of illness or symptom you may have. But if you don't pay attention to what the doctor is telling you to do and how to help yourself, then you can't be surprised when you get a revelation that, oh, yeah, this guy had COVID and never told anybody, because that leadership has poisoned this well in such a manner that people follow. And here we are.
Yeah. And Michael, I'm thinking about this in terms of public persuasion and communication, which is something you know a lot about. There was a time when a lot of people in leadership shared the wrong premise for whatever good reasons, which was, I mentioned this in our setup tonight, getting around a corner and getting back to, quote, normal. New York City's a blue town, for example. They had a big concert planned in the summer about reopening. People in both parties have talked that way. We know the COVID wars are also divisive in more specific ways, like the vaccine stuff. But I'm talking about even deeper than that. How do you summon, as a matter of governmental and public health leadership, the hard message, the hard news to people as we go to year 3, that it ain't about getting around a corner because in the next month or 3 or 5 it's going to be Gucci. No, it's about really delivering the more, grit, tough kind of warlike mentality, if you want to use that frame, although there's limits to that as well, to tell people we got to just get through this over time, because we're not getting back to any certain normal soon.
I agree with that, Ari, and I think that's the challenge that the Biden administration is facing right now. Coming in the door, there were a whole lot of obstacles put in front of it, but it managed to get a good lift off on the vaccine program, et cetera, et cetera. But then Delta hits. And so they've been pushed back on their heels because, once you think you're going to turn the corner, to your point, boom, now we've got, Omicron. And guaranteed by the end of winter, beginning of spring, there'll be something else. And that goes to the overall nature of why what Dr. Patel and others are telling us to please get the vaccination, because, this thing it's going to mutate, it's going to change, but you want to be protected. That's the key thing here. That's what the doctor's been trying to tell us. This is not a panacea. It's not going to heal you. It may not even prevent you, but it will protect you if you do get ill. And that's how you begin to turn the corner on this thing. The more we do, I heard someone talking the other day, Ari, about this whole idea, herd immunity. Yeah, we've reached herd immunity. I'm like, dude, no, we haven't. Only 60% of the country's got one shot, so you've got to understand where we are. And that's the challenge for the political leadership to narrate that challenge in a way that encourages people to understand what's at stake. There's only so much Dr. Patel and others can do. There's only so much they can say. At a certain point, that political leadership is going to have to make it real because of the impact it has on things like the economy and other factors of daily living.
Right, which goes to the premises people operate on and right-sizing this and risk management and all of that. I want to thank Michael Steele, who comes back later, and Dr. Patel for kicking us off. Thanks to